Good morning, everybody. Thank you all for joining us on this very important panel, if I might say that. We all know that climate change clearly is the global policy challenge of the 21st century, and we all have to work together collaboratively to avert the climate catastrophe that might happen if we don't. However, what's less recognized, and which is why we thought this panel was important, is how the inaction on climate will have significant adverse impacts on the health of the globe. And the financial costs of these and the human impact of this is unimaginable unless we act soon. This panel is going to discuss this sort of linkage between climate change and health. It's going to explore how the public sector, the private sector, and the social sector can collaborate to find solutions to meet the growing challenge of climate-related health conditions. We know one thing: if we don't act, the escalation that is going to happen is truly going to impact the most vulnerable people around the world. And so it is really critical that we move. So we've got a wonderful panel here, and I'm just going to very quickly do a round of introductions, starting from my extreme down to here. So we have a Dermot Campbell-Landrum. Dermot is the team leader of climate change and health, the World Health Organization. We have Earthram Cousins, former executive director of the United Nations World Food Programme. We have Liam Smith, the director of the London School of Hygiene and Tropical Medicine. We have Dr. Vanessa Carey, who is the founder of Seed Global Health and a professor at Harvard Medical School. So this is the wonderful panel here that's going to take us through this discussion around this very important topic. Let me first start off with Liam, with you. It would be great if you could make the case for this linkage. What exactly is this linkage, and why is it so important?
So this is about the linkage between climate change and health, and really embracing that as planetary health. And I think there's two elements to that. I think if you think of any attempt to improve the health of the world, and anything we try and do to keep people healthy, and you think what the key determinants are. So think about the Sustainable Development Goals, for example, and virtually every single one of them you look through, and the air we breathe, the food we eat, the water we drink, the buildings we live in, the kind of lives we lead, and the jobs we do are going to be shaped more and more and more by climate change. So the underlying determinants of health are going to be shaped by that. So if you're interested in health, there's really now, it's not like an optional extra interest or a special interest or a niche interest. If you're interested in health, I think for the future, climate change is just an inherent driver of that, both at the population and at the individual level. And I think it's quite useful to break that up. I think we can talk about the direct effects, which we're seeing daily around the world, extreme weather events, flooding, and the direct effects that has on people's health, air pollution, cardiovascular deaths, for example. And then you can think about indirect effects, and we're already again seeing these happening and playing out, be that the spread of mosquitoes, mosquito-borne diseases like malaria and dengue. We're seeing changes in ecosystems, inability to grow food, and the knock-on effects of that. But then there's also the wider impact and the socioeconomic impact, and I think this is kind of a bit less appreciated. And it's not just around sort of issues around mental health, but it's also around forced migration, and also that undoubtedly, I think what we're seeing that in all terms, but particularly in health, it's the least advantaged populations around the world, and the populations in countries with the least resilience are going to be hit hardest and quickest by climate change. And so we're going to see this widening of inequalities globally. And I think that's a really important aspect to all this, that all our efforts to improve equity around the world and improve the health for the least advantaged people are being hit by climate change. And I think we can't ignore that. And if we're going to prevent an ever-widening scale, we have to act. And action has to come from the high-income countries, reducing their own footprint while facilitating sustainable development in lower-income settings.
Well, thank you, Liam. That's very helpful. I'm going to come to you, Vanessa. Just tell the group a little bit about SEED first. And then, from your perspective, right in the front lines of the health worker, how does what Liam say are you seeing impact really at the front line on health?
So I may actually reverse that a little bit
Okay.
because I think it's if we take a moment to look at where we are today. We are facing truly facing two existential crises. There's COVID-19, which has now killed over 5 million people. And there's climate change, which has already, climate change and environmental disasters have already killed over 12 million people, and it's expected to be another 250,000 deaths a year in the coming decade that we will see of excess mortality. And 83 million deaths by the year 2100. So we're looking at a huge rise in the toll of the health impacts that were just described. And this is absolutely going to play out much the way COVID has in terms of the inequities. So who gets sick and die, who gets a vaccine, who has access to treatment, who's going to be hit hardest by climate, who is going to suffer the most from air pollution, from extreme heat, from famine and drought, are all those that are less resourced. So the chasm between those that have resources and those that don't is only going to be growing with this, both with this combination of the health impacts we see in the world today, but certainly from climate change, and really climate change driven by health. The health impacts driven by climate change, because if you think about the basic things we need in life, food, shelter, clean water, and really those are all threatened by climate change. And so the fundamental things we need to survive are what are at risk today as we face this. And so when we think about resilience of these communities and how do you respond to these crises, the work that we do at Seed Global Health is very focused on training a healthcare workforce, because our resilience actually lies in our ability to be responsive, not just to be preventative, but to be able to respond, because we are enough past a threshold that prevention isn't going to work alone. We have to adapt, we have to be resilient, and we have to be responsive. So when I look at the COVID-19 discussions, we often talk, for example, about pandemic preparedness and its surveillance and prevention. But the reality is healthcare workers have been on the front line of treating COVID this entire time. I am one. I'm a physician. I've spent the last year and a half in treating COVID patients. And I think that it's been very frustrating, because it has just come out that 115,000 healthcare workers have died in COVID. We applaud them. We acknowledge it, we mourn them, but much like with climate change to this date, we have not taken action. We are going to be missing 50% of our nursing workforce in the next 2 years if we don't actually start to invest. And so our ability to respond to climate change, to address the health issues, to reduce the vulnerabilities to those that are most vulnerable, they overlap perfectly with where the critical shortages of healthcare workers are highest as well. So we are failing to step in and take action in the places where we deeply need to create the capacity. And that's what Seed Global Health does, is we partner with governments in sub-Saharan Africa, some of the most vulnerable countries, to help them train the doctors, nurses, midwives they need, and further to advocate for the policies they need to build out that critical workforce to be on the front lines of response. And we are in crisis, the workforce. And so we need action there. And that's critical at the intersection of climate and at the intersection of pandemics, and also our ability to treat maternal health, under 5 mortality, because it turns out that 80 to 90% of all disease burdens are in low-income countries. You couple that to the high number of climate change disasters that are happening and the impact in low-income countries, we are failing our world as global citizens. And so I think there's a really important opportunity for us to think about what those investments are and what is the return on investment, which will be both financial if we make these these investments up front. Because it turns out, just one quick fact, the US alone, the United States, spends $820 billion in the health effects of microparticles in soot. That's a single country, and that is 800. So we are really, if we prevent that, you can imagine where the savings would be, and the investments would be much better made in health workforce, in prevention, in clean energy, and in reducing these impacts. So there's a lot at stake. There's immense intersections, and from the work that we do, we see ourselves completely in that crossroads.
It's a fascinating perspective from that lens. Thank you, Vanessa. Earthman, you have a unique vantage position. As the former leader of the World Food Program, and really now involved in in the transformation of the food system. From your perspective, the impact of climate change in the food system, what is it, and what are you seeing as the consequence of this?
Well, thank you very much for that very important question, because the number one issue and the reason I thought it was important that folks like myself and others who are working on food systems transformation are participating in this COP is because food and agriculture are not on the agenda, much like health is not on the agenda. The reality is the IPCC tells us that the agriculture system, our food system, is a major contributor to greenhouse gas emissions. We also know that the food system is quite vulnerable and is the number one system that is most vulnerable to the climate crisis. And as a result, those who Vanessa was just talking about, Dr. Vanessa was just speaking about, those most vulnerable people living in developing countries around the world are also the most susceptible from a food and ag standpoint as related to the climate crisis. The long rains are short and short rains don't come. And we know that that is impacting the access to nutritious food. The lack of access to nutritious food, of course, has a direct impact on health and nutrition. And we, particularly when we are talking about pregnant and lactating women, children under 2, and the stunting that occurs as a result of lack of access to nutritious food, we've seen for the first time in a decade, because of COVID, a reversal and an increase in the number of children who were stunted in 2019 and 2020. That's the tip of the iceberg. The tip of the iceberg created by COVID, but we know that with climate and the lack of the ability of the food system to provide access to affordable, nutritious foods for vulnerable populations, we're going to see additional increases in those numbers. So this is a conversation that, and I of course take no umbrage with the UK government and the fact that it's not on the agenda, because the reality was it wasn't on the agenda in Paris. And so it was a subset in Paris, but now's the time to change it. Now's the time to begin to recognize that food and agriculture and health are not externalities, but must become priorities in addressing the impacts of climate on these systems to ensure that we are not just saving the planet, but we're saving the planet for the people in a just way, ensuring that new tools that have been talked about that are coming online to address the reduction in greenhouse gases, that those are available not just to affluent farmers, but to the 500 million smallholder farmers who provide 80% of the food that is consumed across the globe. That we are ensuring that the 3 billion people now who cannot afford access to a diverse, nutritious diet, that we are providing the tools that are necessary. So what are those tools? The $100 billion that the donor community has committed to investing in adaptation in developing countries for climate. We must ensure that those commitments are met. We need to, as we talk in these rooms, recognize that the opportunity is not just about the mitigation that is necessary, but also the adaptation that is required by so many who are already affected by the climate crisis.
Well, thank you, Earthrin. I speak on behalf of the UK government here. Clearly, and we're enjoying the auspices of the UK government here. There's been a lot of work that's gone in to ensure COP is a real success. And it's been a real partnership with a variety of institutions to bring people together. And I appreciate a lot of big issues. But, if I may start with you, Dermot, just a question. You have a unique role. It's a role that straddles climate change and health at the World Health Organization. Is it on the agenda, not just at COP, but just more broadly? And is it recognized in terms of the role that climate change plays on health? And what is the World Health Organization's position on that?
Well, I think the World Health Organization's position on this is very, very clear. We think that climate change is the greatest public health threat of the century. We have been saying that for over a decade now. So we're in the slightly odd position as WHO of having published our first report on climate change and health in 1990, our first book in 1996. Our Director General hit that alarm bell, the greatest public health threat of the century, in 2007. It's been on the front cover of the Lancet. It's been on the front cover of the BMJ. And we know this, and we continue to keep saying it. And it's also quite high up on the agenda now of the World Health Assembly. There are resolutions on this. Everybody is accepting it. We also see that in the climate change negotiations themselves, going right back to Rio, the overarching declaration in Rio makes reference in the first line to health, that we have the right to health, the right to a healthy future. The climate treaty that same year, Article 1, refers to the right to health. The Paris Agreement refers to right to health. So it's very clear on paper. The problem that we have is that people sort of seem to just accept that, or they seem to assume that if we're doing something about climate change, then the health implications will be taken care of. And so it's not really feeding through into the mechanisms. It's not really feeding through into the narrative, as you have said, that the issue is no longer just about protecting the environment. I say just, I mean, that is centrally important. But a central motivation for most people, if you ask them in the street, if you ask them, what are you concerned about in terms of climate change, and you have human health, you have environmental protection, you have endangered species, they will take human health as number one, because that's the number one priority for them. And yet that isn't really reflected in the mechanisms and the narrative. And just to show basically the lack of connection between the things that people actually think are important to themselves and what goes on in the climate change discussions or the wider economy. So we've heard some of the big numbers. You're quoting, Dr. Kerry, the numbers about the economic costs of pollution in the US. So you may be aware that the IMF, who are hardline economists, they're not hippies, they estimate that we provide as society an effective subsidy of $5.9 trillion a year to prop up fossil fuels. Part of that is a direct financial subsidy, but in fact the largest part, or about half of that, is the damage that we pay in our lungs for the uncompensated impact of burning fossil fuels that cause the air pollution, that cause all of these problems. So we have an economic system which fails to act even in the economic interests of society, let alone the welfare interests of society. And I think that the failure to make that positive narrative about the things that we need to do to protect people's lives and health, and also the advantages to health that would come from doing all the things that we know we need to do to protect the climate. We know we need clean energy systems. We know we need not only climate resilient, but also sustainable and healthy food systems. All of those things they're the answers to the climate crisis, but they bring really massive health gains, even in the short term, to local communities. So I think that if a global pandemic isn't enough to convince people that environment and health are linked and health is important, I don't know what is. And I think that now is the time, really, to try and change that conversation, to actually engage people on talking about a positive future, which is resilient to all of the threats that climate change is already throwing at us, but also makes those changes that are not only to protect the planet, but are also just generally good for society.
Deborah, it's a great set of observations, and it clearly has been part of the written narrative, if I might say so. But if I were to just take the experience of the last 18 or 21 months of the pandemic, we've seen massive cuts in the health system. We have seen massive cuts in terms of investment in hygiene and sanitation. If I just think about intimate wellness, which is a business we're quite familiar with, it's with our brands. If I look at some of the crisis centers and the funding for them over the course of the last 21 months, it's been cut enormously. If I think about the front line, I mean, we are sort of in a trapeze in some ways, where the music was playing and we were swinging from one swing to the other. Music stopped, people started falling. There was a safety net in some places that caught many people, but some fell through the net. And the people who got caught in the net recognized the value of the net, be it an economic net, be it a health net, be it a social security net, whatever we want to think about. And they also recognize the value of the people who woke up every morning to tighten the net, the frontline worker. I'm just wondering, if I think about just the last 2 years, even if I were to spread it, What's the situation on the ground? You mentioned a bit, Vanessa. Maybe you can expand a bit on what exactly is going on the ground with the frontline health worker. And then I'm going to come across to each one of you just to give you your sense about how has this in some ways amplified the issue as opposed to, in some ways solve it.
Well, I think in the healthcare worker crisis that we're already facing, it has definitely amplified because not only have we had at least 115,000 healthcare workers die from COVID directly, but there's been a large attrition of healthcare workers out of the system because of unsafe working conditions. In fact, only 2 out of 5 healthcare workers has been vaccinated against COVID globally, only 1 out of 10 in sub-Saharan Africa. It's appalling. And yet we have been on the front lines of responding to COVID. There's been shortages of equipment. There's been shortages of the tools we need. There's not enough oxygen. It is deeply painful to watch a patient die because you run out of oxygen. Not because you didn't have the skills or not because you didn't have everything you needed. You just ran or the electricity goes out. That's the system we're operating in. And so I think that, it's very real. We are dispirited. We are exhausted. And I think that when we think about them, and I think that what really gets us as healthcare workers is, frankly, that there isn't investment in the healthcare workforce. I speak as the CEO of an organization that partners in sub-Saharan Africa. The governments we work with have to, want to prioritize their healthcare workforce. They know it's needed, but they're saddled by the fact that everybody says, well, how are you going to pay for it? Well, when you don't have a high GDP because your population isn't healthy, they can't go to work, you are reliant on agriculture still and the environment is destroying it, when your children are increasingly getting stunted now because of the food insecurity that was just described, it is very hard to grow a GDP. Many countries are already dedicating 10 to 15% of their GDP towards health, but in absolute dollars, it isn't enough. This is where the global community has to realize that health, pandemics, climate, it's a global public good. Therefore, we have to protect it as such, and we have to ask ourselves, what is our proportional contribution based on the resources we have for all of our good? We can put enlightened in quotes, self-interest, but we all benefit if we make these investments because, no one is safe unless we're all safe. And so, and further, I think investing in the workforce is critical when you have growing populations that need jobs. It turns out that for 2% investment in the social sector, you get a 6% increase in employment. Those jobs mainly go to women. When women are employed and formally recognized, you actually see improvements in education of their children, improvements in GDP. There's a whole network of benefits that happens. And so it makes sense. And we really have to, I appreciate your point. If this moment doesn't do it, what moment does? Because it doesn't get more existential than the moment we're in. We are talking, and I don't mean this grandiosely, human survival is at stake right now from one form or another. And so I think that, we have to start to change where we value, where we invest. Nobody in 40 years has invested in the healthcare workforce. We've been very disease focused, and therefore we've missed the opportunity to leverage those investments in a way that create prevention, that really focus on being able to kind of not only treat, but sort of, do things differently and to stave off some of this. And instead, we are continuing to see countless lives lost unnecessarily. And that is just counterproductive to what we're trying to achieve.
Thank you. Uthran, just from the standpoint of the front line, the food crisis is already in some ways showing itself up. I know that we had the mayor of Freetown yesterday speaking about the fact that the level of carbon emissions from a country like Sierra Leone is obviously extremely small. Maybe, the debate is whether it's 0.5% or 4% or somewhere in that range, for countries in that range in sub-Saharan Africa. But at the same time, the impact they face is enormous, given how agriculture-based they are. What are you seeing on the ground, literally?
I smile as Dr. Vanessa was talking about the impact of healthcare workers in Africa who have not been vaccinated. One of the things that we're seeing on the ground is the fact that COVID is a zoonotic disease. And we know that agricultural production And in places like sub-Saharan Africa and Asia, where the productivity of land does not provide the amount of food that people need, they cultivate more land. They go into areas that were not traditionally the areas for cultivation. There are areas where they are interacting with animals in different ways, and we are seeing a rise in zoonotic disease, whether we're talking Ebola or COVID. And that is a direct relationship to what climate change is doing to force people to farm differently. And that's why I'm really excited. I'm also on the board of Bayer, and one of the things that we are looking to do is increase the access to drought-tolerant, drought-resistant seeds that can produce more on already cultivated land, to ensure that that farmers are not required to increase the area under cultivation, moving into areas that create problems. But let me give you one other example. We continuously talk about providing for investment in developing countries to support their agricultural production, their responses to the climate crisis, increasing access to renewable energy, et cetera, et cetera. But when COVID came, programs stopped. Investments stopped, because everything did. And so we have a good example in Rwanda. We were just beginning work with the commercial poultry and egg industry in Rwanda. But then the borders closed and the markets closed. And so farmers the producers had no place to sell their product. And so we were in a situation where the producers were going to be forced to cull their birds because they couldn't afford to feed them. So instead, we were able to get money to buy all the inventory, to keep the business continuity of these nascent producers and their smallholder farmers that they're working with, and then worked with the health department to include eggs in the basket of the most vulnerable, with children under 5 that would not have otherwise had access to an animal-based protein during COVID. And so it is those kinds of projects where the agriculture community, working with the finance community, working with the health department, can change outcomes. Part of the challenge and the opportunity that we have in conversations like here at COP26 is to get out of our silos. Because our silos between the health community, the agriculture community, and the climate community is detrimentally impacting the people who need us most on the ground, who are most vulnerable to the effects of climate. We can make a difference when we are working together.
So let me take that on and just move into solution mode here, because clearly we all recognize it's a grave issue. It's gotten graver in the last couple of years. And so, Leon, let me start with you first. Research that you're doing around solutions. How does one begin to think about addressing this issue?
I think you have to take it across the whole spectrum, and I think academia or scientists can really play an important role, really ranging from looking into the future, looking at future scenarios, and that's really important because we need to know what to plan for and what to do, but whether that's health systems, whether that's social measures, whether that's flood protection, whatever it is. I think science can tell us simple things like what the burden of disease, what the burden of health needs are, what the main problems are, and really importantly, what's driving those. And that's going to be increasingly important in the future. What are the drivers that are really leading populations towards ill health and towards suffering the worst impacts from climate change? And then it's about coming up with solutions, obviously, once you've identified what the needs are, and making sure we really evaluate those. And I think that's really important, because if we take preventive measures, which is much better to prevent disease than to treat it, always. Far better to never have it stay healthy in the first place. And you look at treatments, and you look at the average drug treatment, and this isn't a criticism of anybody, but $1 billion would go into developing your average drug. Understandably, it's what it needs. And there's money down the line that you recoup in drug sales. If you take a preventive intervention, I don't know many preventive interventions that have had more than a few $100s spent on them. Most of the ones I've been involved in, we've kind of thought of sitting around a table for free. And then we've tried to implement them and evaluate them. And lo and behold, quite a lot of them don't work. Well, maybe if we spent $1 billion on preventive interventions and accepted that the payback wasn't going to be in cash terms, but it was going to be in improved health and keeping people healthy. And I think that's where we really need to do better. So we need to develop better interventions, and that process of developing interventions that are context-specific, that are draw on local knowledge, local expertise, and really are going to impact on the localities that need those interventions. But then they're also evaluated. And so we're clear we're spending resources and, and doing things that are actually going to improve health and they're actually going to work. I think it's really critical, and I think that's where I think science can play a part, and getting those interventions implemented widely. And there's the same thing, there's no point having interventions that are so great and perfect that when you study them, they achieve amazing things. But the minute you turn your back, they're just forgotten about. We've got to have interventions that are sustainable, interventions that are easy and cost-effective, that people like, and that they like implementing, and they like doing them. But the focus on prevention, I think, is the key.
I think, by the way, that's a really fundamental thesis of our business, which is we are a prevent business. And we're focused a lot on behavior change, in addition to ensuring that some of these behaviors, whether it's hygiene or health or nutrition, really come through. Earthrin, again, from your perspective, so I look at the collaboration aspect. You have a unique perspective because private sector, public sector, social sector. Could you talk a bit about that? Because that's got to be an element of how this works.
It is definitely a priority that we have multisectoral action. That when we talk about, we just finished, the UN just completed the UN Food Systems Summit. And there was a recognition that in changing to a just transition of the food system would require private sector, public sector, civil society working together in order to ensure our ability to change. And you had 101 countries come forward with pathways to transitioning of their food systems, and they came forward with these with plans for their pathways forward that were built upon commitments for finance and support for capital, for capacity development from private sector, government commitments for additional financing and investment across the food system, as well as the indigenous populations and how you work together with them, and private sector. Those pathways are not included in their NDCs. And so if you have pathways for transition that include multisectoral actors for the transition of the food system, but it's not part of the NDC that you're reporting on how you are going to address climate, we're passing each other in the night here. We are asking so much of government, but we are not providing the mechanisms that are necessary to ensure that we are avoiding the very complicated system that we've created. But when we talk about private sector as well, the other issue that I think is critical that we speak to is it's not just about new programs. It is about private sector investing in scaling up businesses and giving small and medium enterprises the ability to move beyond subsistence to actually growing to a point where they build resilience, not just for their business, but for their communities and ultimately for the countries where they are working and serving. And that resilience will then also invest in the GDP of that company, of that country, giving additional capital to ensuring that the government has more money to invest in things like their healthcare system. And so it is not unless we have private sector investment coupled with public sector support that we can then grow businesses in that manner. The last thing that I would say is that one of the challenges that we have is when we talk about food as part of the food system's transition and access to nutritious food for the most vulnerable, we often talk about it as an intervention for therapeutic intervention. Food is medicine. We don't talk about food as health and ensuring availability and affordability of nutritious food for those 3 billion people around the globe who can't afford a nutritious diet today. And that is quite critical to what we want from that engagement between the private sector, the public sector, and civil society.
Thank you. Dermot, to you, we've obviously heard a lot about the challenges in some areas of collaboration that would come together in order to make a difference here. But one of the big areas and one of the big issues is the capacity building in the countries. And I'm going to come to Vanessa as well on this after this. But can you talk a little bit about, capacity building? How much of that is on the WHO agenda? So clearly there's a question around how do we get it on the agenda of forums like COP, but also capacity building. What's the WHO's perspective on that?
Well, obviously that's absolutely critically important, because the capacity of the health workforce to do what it needs to do just to meet the demand which is already thrown at it by the everyday health problems, and then COVID on top of that, the strain on health services is absolutely immense in normal situations, if you like. And as Dr. Carey has said, we, speaking as somebody who works within the health community, we have lost a lot of people. There have been tragic deaths among frontline healthcare workers. A really tragic number of those have lost their lives protecting the lives of other people. They need all the support that they can get. And one of the things I would say is that support is always repaid. If you invest in the capacity of healthcare workers, society gets that back several times over, because these are people who are highly intelligent, they're highly committed, they have an oath of service effectively to their community. They are already perfectly motivated to do everything they can for their community. And so in our program on climate change and health at WHO, that is probably one of the biggest demands that we have, is capacity building. And a lot of the time it's actually about empowering these people, because when we talk about the health risks of climate change from malaria or extreme weather events and so on, the initial reaction of the health workforce is to say, climate change, big new problem, don't really know what I need to do about that. But then when you break it down and say, well, actually, it's just exacerbating your malaria problem. You know how to deal with malaria. It's exacerbating your problems with water and sanitation. You're actually pretty good on water and sanitation. So a lot of that is just giving them the structure and the capacity to bring out the skills that they already have. And so, yeah, we run now significant climate change and health projects in over 30 countries around the world. And that the immediate big demand is in empowering, and it's really mainly empowering the health workforce. And one of the things I'd like to say about the repayment that you get from that is not just in their role in protecting people's lives from climate change and everything else, but they're also the most effective advocates that you can think of for climate action apart from anything else. So, we have people on the panel who are clinicians, probably people in the audience who are clinicians. So congratulations, that makes you a member of the second most trusted profession in the UK. The only profession that beats clinicians is nurses. So once you've got the health workforce coming forward and saying that we want to act on climate change, on top of everything else that they're already doing, then you start to see that being normalized in society. And so in the UK, for example, we've seen hospitals declare climate emergencies. As representative of the first hospital to do that here, Great Ormond Street Hospital, legendary hospital in the UK, declared a climate emergency last year. We see the NHS in England has set the target of becoming climate neutral by the 2040s. They're making major investments and they're cutting carbon emissions. All of that in the face of a pandemic, and you have these people speaking up on behalf of climate action. And I think that's one of the things that you start to get back when you invest in the health workforce.
I'm going to come back to each one of you after this next question, just around one ambition for next year from now. Just one short, snappy answer about what's the one wish you would have. So I'm going to get you to think about it. But before I did that, I do want to come to you, Vanessa, just around your thoughts around capacity building, your thoughts on, as you bring this all together, particularly with regard to the frontline worker, what do you think the solves really are?
So, I think it's interesting because in COVID, we actually continued, part of our model is that we embed faculty to fill the faculty shortages in these partner countries in order to help train. And we've trained close to 28,000 doctors, nurses, and midwives in the last 9 years in an effort to be able to build out that capacity. And And one of the things we've seen is that it was our clinicians and their teams that continued, and really the teams, but together in partnership, they would have the courage to show up and to care for patients in COVID and to do the right diagnoses and to employ these things. And I think that effort makes a big difference when we sort of think about what is the solution. The solution is to create that capacity. How do we do it? We are going to have to mobilize a huge amount of funding. It will pay itself back and then some, but I really want to appreciate Dr. Smith's point of part of the return on investment is just the value of health and well-being and thriving. That's an excellent return on investment. We need to change our timelines. These programs cannot be 3 months, 3 years, 5 years. We need 15 years to build the capacity. There's a phrase that people use which says, when's the best time to plant a tree? 30 years ago. When's the next best time? Today. So we're planting theoretical trees, real trees, the whole bit. But we have to change our timelines. We have to uncouple policy from social sector investment so that IFIs can no longer say you can't invest in your social sector anymore. We need to go really big in this moment, and we can. We can really mobilize around this if we choose to, but it's about action. I want to end quickly with just a story to tell you about the power of the healthcare workforce. We had an obstetrician who went to teach in a country where 1 woman dies every hour from a complication of pregnancy or childbirth. She was called to the OR for a woman who was dying. The mother died, her children died. She lost 3 patients because they were twins in a span of 5 minutes being called to the operating theater. The next day, she was called again to the operating theater with a woman who'd been in obstructed labor for 3 days in her village. There'd been no health care to care for her. And the baby had already died, and she was going to be damned before she lost another patient. She saved that mother's life. More importantly, she saved the lives of 5 children who were at home, who are now less likely to grow up to be socio and economically disadvantaged throughout their lifetime, or more likely to have food security, to stay in school, and to have that livelihood. But she also taught all of her colleagues when and how to do that same life-saving procedure. So that now, in an area of the world where 1 woman dies every hour from complication of pregnancy or childbirth, there's a whole new cadre of health workers to deal with that. That's the lasting legacy, and you can't put a financial value on that.
It's a great point. And I think one thing, if I might add, as a private sector representative, you walk around this place and you see Dettol. Dettol was a brand, was created in 1931 to address maternal sepsis. One thing we have found is technology is a great multiplier. And I think the ability for us to use technology to drive behavior change, like we've done particularly on hygiene habits in places like India, or teach children how to be, is really a very important step in prevention to ensure that we pressurize the health systems less. So just to close, and we have just a couple of minutes, I'm going to go around and say one ambition. And if we had COP27, which is, I guess, in Egypt next year, in 1 year, what would you expect to have happened? Dervin, I'm going to start with you. Just one ambition. What do you think would have happened over the course of the next year?
I think my one ambition is that people start talking positively about the picture of the future that you get if you make this transition, so that it moves the conversation away from the costs and all of that stuff, because most people actually want cities where you can walk and cycle and people eat healthily and you can breathe clean air, because I think that is what starts to crack it, rather than making this just a burden. It's just the path to a more sustainable, more healthy future.
So it's a positive narrative,
Yeah.
really amplified, that people recognize the link and the value. Right?
Yes.
Ertrud.
In 1 year, as we go to COP27, I'm hopeful that food and agriculture will be a priority along with energy and transportation, and that we're talking as much about adaptation as we are about mitigation.
Terrific. Liam.
Tiny one would be net zero by 2030, but maybe more realistically, I hope we've made massive steps in really embracing this passion of the next generation to make the world a better place, to tackle climate change, and to improve human health and bring that together in the next generation, particularly in science, where research, meaning everything from innovation to implementation to health impact, and really can we embrace that passion and energy and bring those people through and get them start to get them trained into leadership positions around the world so they can really make a difference.
Great. Yes, sir.
I think that people stop viewing these investments as a zero-sum game, but one that actually has exponential positive leverage, and that we start to use that to close the inequity gaps that are just growing at the current moment in time.
Terrific. So there's value for the investment. There's, the research acknowledges it. The narrative has changed, and that the agenda reflects the importance of the health system and the food system. That will be an ambition for the next year. I want to thank all my panelists. I think you were terrific. I just want to say one final thing. Sorry, did you have a question? Go ahead.
Thank you very much. I'm a One Young World Ambassador and Master Science in LSST. I'm student, and it's speaking about your advice or ambition for the young generation to take the lead. I would love to hear some advices from all of you for young health professionals. How can we engage private, organizational, study sector? Would love to see what ambitions or expectations are we waiting for.
Can I just repeat your question, because we're live streaming and you don't have a mic, if that's okay? I think the question is, what's the advice to young healthcare workers or young healthcare professionals around what they could do in order to amplify the message and to make a big difference? Is that fair?
Yeah.
Perfect. So maybe you want to start.
I'm going to let the
Go
dean
ahead.
start.
Let the dean start.
I think, as Dim said, I think, carry on what you're doing. Advocate is really important. Keep going. I think the future of health, climate change is so inherent in that it won't, it'll soon be just totally mainstreamed anyway, doesn't it? We can't just carry on ignoring it in terms of health. I think we just really need, and it's not just in the UK or high-income countries, across the world, there's that real need to build expertise and capacity, both in healthcare settings, but also in the research and innovation settings as well. And it's that next generation are really going to make the massive difference, and that's where we need the investment. So you keep going, and I'll keep trying to raise money to do that.
I would really second the power of your advocacy. We as healthcare workers don't advocate enough, and yet the powerful narratives from the front lines are critically important. In Boston, Massachusetts, we were one of the first to recognize that it was primarily Hispanic people that were getting sick, and that there's a disparity in who got sick and died from COVID. It was Black, communities of color, communities that were poor, because we realized that's who we were seeing in the hospital. So we were able to raise that alarm faster and louder, and to help think about the community strategies that could help mitigate that. So you have a very powerful voice on the front lines. You should use it, and know that you can be the best advocate for your patients, for the system, and for where we need to go.
Terrific. I'm going to cut it there if I could. I really want to thank all of you for joining this panel. It's the first time we've actually done it. I just want to say one thing. I know the Prime Minister really recognizes the linkage between planetary health and public health. Absolutely. And I know that the agenda will over time certainly reflect that. What I will say is we as a business are based on this. We're based on the idea that prevention is what we're about, that the prosperity of the country depends on its health. And by the way, although we're not in the food business, it certainly helps with the food. And the health of the business is based on hygiene, because hygiene is the foundation for health. And some of the work we're doing at LSHTM is based on that. I want to thank all of you for joining in. Thank you very much for your comments, and thank you all for joining here as well. Take care.